The higher your vitamin D levels, the lower your chances of getting breast cancer, chemotherapy, anti-cancer drugs, and the fact that it significantly reduces the need for surgery. It turned out to be a paper. The study was conducted by a research team at the University of California, San Diego, with an average age of 63 years. This is the result of analyzing data from clinical studies. Research has shown that vitamin D is really going to be effective in preventing breast cancer. 20. It should be more than 60, which is higher than the recommended figure. To be more specific, when the study results are higher than 60, probability of developing breast cancer is higher than 20. The result is that it is reduced to less than 1 in 5. In fact, this idea is nothing new. If vitamin D levels are maintained at around 60 over the past few years, they are significant in preventing most chronic diseases. We have prepared a report that says it works. In addition, a research report published in the Environmental Health Perspectives, results of experiments conducted on the sisters to identify risk factors for breast cancer were published. The results of the study show that if the vitamin D level is 38 ml or higher, 24.6 ml, the risk of breast cancer is 21 lower than the below cases. And of course, the point to highlight here is what these experimental results show. The higher the vitamin D level, the higher the breast cancer prevention effect. 38 ml doesn't mean it's good. Vitamin D not only lowers the incidence of breast cancer, but also reduces the stomach prognosis of breast cancer patients, have a positive effect on. A 2017 research paper published in the Journal of JAMA Oncology found that breast cancer patients with the highest levels of vitamin D, in this case, it was found that the survival rate was the highest. Of course, vitamin D is not only effective for breast cancer. According to a report released by Grassroot, a nonprofit organization promoting vitamin D, it was announced that almost all chronic disease rates fall to the bottom when vitamin D levels rise above 60 ml. Vitamin D and hormone balance. One of the important things about vitamin D is that it acts as a steroid hormone in the human body. It helps the body produce and control various hormones. In particular, low vitamin D levels lead to an imbalance between the sex hormones estrogen and testosterone. Women may experience menstrual irregularities or infertility problems when estrogen levels are too low or too high. Men, on the other hand, may experience changes such as decreased libido due to decreased testosterone levels. Vitamin D also plays an important role in regulating insulin secretion. Insulin is a hormone that controls blood sugar, and if these levels are unstable, the risk of metabolic diseases such as diabetes may increase. Vitamin D deficiency is also associated with depression. Vitamin D affects serotonin synthesis. Serotonin play a very important role in controlling moods and emotions. Therefore, a lack of vitamin D can increase depression and anxiety. Vitamin D is not just a nutrient, but it manages the balance of hormones in the human body. Be an essential substance. If you eat it properly or get high-quality sunlight, it's health efficient. It can create a hormonal environment, which can lead to physical and mental health. It will have a very good impact